guitar string just so simple, straight, like this, like a very tight wire or something. But guitar has 6 strings. And we were talking about the thinnest, the straight pulses, additional. So this guitar string, the difference between this and the zhenmai, actually they're quite the same. The only difference is the level. Zhenmai got something to do with the genital area, with the reproductive system. The zhenmai is very deep attached to the bone. It doesn't move much. So no matter how hard you press, it will still be there. But the guitar string is somehow like yin-chao, flowing between the skin and the bone, like something flowing inside the muscle. It's straight. Why? The reason we say guitar string is because it's tight. Tight means you cannot destroy it. No matter how you move it, it's still there. Sometimes you got a feeling it will cut your fingers. Some so can be so tight. And it feels about as zhenmai, but it's too deep. The zhenmai is a dead pulse, actually. It's so stubborn, it just stay there. It won't move. But the rest of the guitar string is a little bit okay. But the guitar string can be very tight or not. The tighter it gets, the worse it gets. So the tight means some kind of a constriction, severe constriction. We will not consider it as a severe coldness. We just call it pain. It's the bone spur. I don't know why. How do I explain the bone spur will appear pulse like this? Will give a pulse? We don't know. It's just like that. So that you can verify from the patient symptoms or from the ear point that the sciatica area, that they'll have a lot of pain here. So that's bone spur. Bone spur is not a very accurate term because sometimes it doesn't have a spur. It's just a disc herniation or something. But anyway, we use that to cover all these symptoms and all the pathological condition. That, like we use in Taiwan, something, just bone spur. Everybody understand that. So, actually it's good because there should be 2 groups. First is the younger people. The second group is elderly people. Younger people don't have bone spurs. They only have herniation of the disc or from injury, from impact, from trauma or something. Actually, there was a crack of the disc or there's no spur. But for older people, elderly people, there definitely will be spur. You can clear spurs sticking out of each rim of the joints. And sometimes when the disc, intravertebral disc, becomes so dry and they crack and stick out, we also call it bone spur. But actually the treatment will be the same. Because I imported something from Taiwan, tree leaves, that especially designed for bone spur. Not only will stop the pain, but also dissolve it somehow. Anyway, it's a treatment, not just stop the pain. It cannot stop the pain. Even you have injection on the back and the lumbar with some kind of strong painkiller, sometimes it cannot. This one will do, because it contains a certain tree leaves only I have from Taiwan, and now made into medicine. So you just buy the spur, flax spur formula for any kind of pain. But you have first, seems to be easy, which is one formula already done for you. But difficult part is first, you have to find out this patient sitting in front of you has the bone spur. And second difficult part is that you have to differentiate if the pain, maybe he already told you, hey doctor, I have the pain here. You have to differentiate whether the pain was caused by kidney stone, or injury, or having too much sex, or bone spur. You have to tell the reason, then he used. Once you find out the cause, the treatment is not that difficult, right? You have all learned from Dr. Tang's magical 1, 2, 3 process needle points and your own invention. That can be done easily, right? But,
remember you said earlier that the flex spur formula has a greater affinity for the upper back?
Yeah.
So
I don't know why.
I know, but you want us to use a flex spur for the lower back.
This is for spur, not for...
If there's a spur in the lower back.
Yeah, not for arthritis. This is not... The spur formula is not good for arthritis. Not good for gout or any kind of arthritis. Okay? If you have problem with arthritis, you can just try my astringent one. Astringent combo. Yes? Just use both. But if it's a sex hormone problem related, that can be a little bit difficult. Maybe you can treat the spur first, the other one later. See which one is more acute. Or you can ask. The only thing I ask is, most of the time I ask, what do you want me to do for you today? Most of the people say, all of them, do them all. That would be difficult. At least you should give them a target, what to treat. Right? If you don't have any symptoms, I don't give medicine. You have symptoms, I'll find out why. Because if you don't have any symptoms, ask for treatment, next week, I'll ask, how do you feel? Of course, you answer, I don't feel anything. I didn't feel anything at all. I hate that response. I hate it most. Sometimes I get so angry. I was about to say, don't come back. Go to your medical doctor. I know it's not, it's not good, but I want to avoid that condition as much as I can. This one is difficult, huh? Thin, straight, wiry constriction. This is a constriction pulse. We've been talking about the thin constriction pulse early in this morning, and we say there could be one attached to another along by the side, and it can be it just itself very thin pulses or something. But this one is the pulse within a pulse. Like you may ask, what will be in the pulse? I don't know, but there's something there. Sometimes, well, the pulse feels like it's a bundle of electric wires, just like the electric cable. We have the outer, outer thing covered by rubber tubes, but inside, can you do that for me? Or whatever, there's something inside the normal tubes. The bundle is not the only one. It's very thin. I think it's thinner than the hairs. So we call it a pulse within a pulse. You will ask, there's nothing but blood in there. What else can be in there? I don't know. This is just something there. This is the pulse within a pulse, very thin, very bundle. Not just one. Most happen left chun. I'm sure you have a lot of patients with a cardiac problem, right? The pain, infraction, or angina, this pectoris, whatever. That's the time you learn from them. The left chun, okay? This pulse within a pulse. So that would be a skill to take that pulse. Well, whatever. If you put a needle in there, that's pulse within the pulse. Okay. When people have this problem, with the heart problem, constriction, severe blockage, the actual pulse should still be the same with a normal diameter. Maybe this is too thick, but there's something like that. And for example, you already know this guy is suffering from the pain, the chest pain and heart problem, and taking a natural glycerin or any heart medicine or like the Vicodin or the blood mover, Coumadin or something. So that's the time you learn. This is normal pulse. I mean, his left chun. Okay, the skill for finding this pulse within pulse it's not difficult. It's easy. All you have to do is press it and roll it and push down and move this direction along its long axis. Do it like this or roll it over because the pulse within the pulse is inside. You have to roll over the outside, the normal vessel to find what's inside. You have to do is push it and roll it and you'll find something inside. because the outside, the normal pulse could be very soft. So it can be easily, it's softer than the straw, can be easily destroyed. And the pulse within the pulse, most of the time, is very tight and strong. The tighter it feels, the more dangerous the condition is. If it's really tight as a bundle of blade, or you feel something cutting your finger, then the patient can die any minute. So be careful, huh? Maybe he doesn't show any symptoms or something. You know, some patient with a problem, they don't even have enough pain in the chest. Most of them they have. So always, because this is a severe, the explanation of the condition, it means it's a severe coldness. The coldest condition, like 50 degrees below zero. So frozen. So there's no fire, there's no sunshine in the human body. So if the pulse appears on the left twin, it's sure is deadly, right? Left twin is the heart. Heart is the fire of emperor, right? So the emperor cannot be threatened by anything. So the coldness is there. There's a deadly condition for heart failure. It's not failure, it's just acute fatal condition. So the pulse within the pulse, the condition depends on the feeling of the inside. Sometimes we have that. I have a student here, as an American. He was a marathon runner. He's young and skinny and strong, but he has this problem. He has the pulse. Young and strong, so and skinny. He's a long runner, so his vessel is thick, very thick, like this. But it's something inside. So he has problem from time to time, like this, in this area, heart. So, but he's not. The condition is not deadly because the pulse within the pulse is soft. It's not like steel wired. If you have any patient with a, like 80 years old or something, with a heart condition, if that pulse becomes very tight, and that's dangerous. That guy I mentioned didn't even know he has the problem because he doesn't have much symptoms. He can run a lot. He doesn't have a symptom. But something, if happened, then it happens. It's dangerous. But most of the time, this happens to elderly people. So next time when you have a patient with a heart problem and cholesterol, blood pressure stuff, you can certainly find it. And I guarantee you, once you find it, you never forget. But you have to be familiar with my skill. You can check my pulse book. I have a diagram in there showing how to take the pulse. Touch it down and squeeze it and roll it and move your finger like this in order to get rid of the outside rim and just find something inside. Or you can go home, get yourself a straw and put 2 or 3 acupuncture needles in there and try to feel it. Just exactly. If you have the rubber tube, do you have a rubber tube? You know the one they use to draw the blood, the rubber tube? Huh? Yeah, not plastic. Huh? Has to be rubber. Then you put some acupuncture needle in there. Needles like 3 or 4 or 5, it doesn't matter. So you do it my method, this hand method, this way to find something inside. That's easy, just exactly the same thing. Most of the time, they have been through all those treatment from medical doctors for many, many years. Then when the Coumadin or something doesn't work, they just try to find us as a final option.
But they're still taking Coumadin.
Yes, okay. So don't use any leeches. We don't need leeches in this area, in this condition. We need openers and warmer. In this case, in 伤寒论, it's not 伤寒论, 金匮要略, the golden cabinet book or something, it's called the 胸壁, the close of the chest. The saying is very, very good. Our ancestor says, there is no sunshine in this man's body, like 40 degrees below zero. So what do? How do we bring sunshine to his body to save his life? Huh? Yeah, how? Oh, it's already there. Come on. 我跟你讲 if he's taking Coumadin or some other blood thinner, then don't use the circulation Sanjar. Be careful. So I asked him to write down what kind of herbs, Western medication they're taking. Most of them is okay, the hormone, whatever. The Coumadin is dangerous.